Today, we're going to be talking with each of you grandmothers about communication disorders and ways to prevent them. First, we would like for you to know that you are valuable. Grandparent power, which means the power to love, care for others, and grow personally by doing so. Studies report a majority of today's population of grandparents are raising their children. In fact, based on the 2014 census, roughly 4.9 million children are raised by their grandparents. Therefore, you are not alone and a crucial part of your grandchild's life. We will be presenting information dealing with speech and language. We will provide you with some basic facts and ways to prevent speech and language problems. Grandparents are spending an extended period of time as primary caregivers to their children. As you can see on this chart, some 55% have been doing so for 3 years or more. Your grandchild should be communicating through speaking. So what exactly is speech? Speech is defined as how someone communicates verbally, ergo talking. And speech consists of the following aspects: articulation, which are how speech sounds are made; voice, which is using vocal folds and breathing to speak; fluency, which is the rhythm of speech. Some children have problems with speech sound production, which might be called a speech sound disorder or an articulation disorder. Another aspect of speech is voice, and voice focuses on how we use our vocal folds or our voice box and breathing for speaking. There are a multitude of problems a child might encounter with their voice because of all the rough things that we do to our vocal folds. For example, screaming is dangerous to the overall health of our vocal folds, and you probably have seen your grandchildren screaming quite often. Finally, we'll discuss fluency, yet another aspect of speech. Fluency is a speech pathology term for stuttering. If your grandchild is not stuttering, we would say that they are fluently speaking. However, some children do have stuttering-like behaviors, in which case we would say that they are being disfluent. Communication disorders in young children. Nearly 1 in 12 children ages 3 to 17 has had a disorder related to voice, speech, language, or swallowing in the past 12 months, and more than half of them receive intervention. We tend to see larger numbers of cases in younger children, so about 34% between the ages of 3 to 10. What exactly is a communication disorder? It is an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbols. It may be evident in the processes of hearing, language, and/or speech. We're going to focus mainly on the language portion of this today, but we want to provide a brief overview of the other areas of communication disorders as well. A speech sound disorder, some signs would include substituting one sound for another, as in wabbit for rabbit, leaving sounds out of words like the word winnow for window, changing how sounds are made, and this is called distortions. There are some prevention tips for speech sound disorders. You need to be talking and reading and playing with your grandchild every day because children learn sounds and words by hearing and seeing them. Take care of your grandchild's teeth and mouth. Have your grandchild's hearing checked, and have your grandchild's speech screened at a local clinic or school.
The next aspect of speech that we will be discussing is stuttering. And stuttering is an interruption in the flow of speaking, which is characterized by a different rate or strange rhythm compared to how normal speakers would use their words. They also may have repetitions in sounds, syllables, words, or phrases. Many children stutter sometimes, and it is normal, but if it persists or is something that is common in your family, your child should be evaluated. Signs of stuttering include repeating sounds at the beginning of words, like ball, pausing while talking, stretching out sounds, snake, or saying and a lot while talking. Some tips to prevent stuttering disorders: giving your grandchild time to talk, don't rush them. Try not to interrupt them while they're speaking to you, and have them tested by a speech language pathologist if you are worried. The next speech disorder is a voice disorder, and this includes signs that are hoarse, breathy, or nasal sounding voices, speaking with a pitch that is too high or too low, talking too loudly or too softly, or if they lose their voice very easily. Some tips to prevent voice disorders: try not to let them shout or scream or talk in really noisy places. That will put a strain on their vocal folds. Drink plenty of water. That will keep them hydrated and keep their mouth moist. Help your grandchild avoid caffeine, chemical fumes such as those from cleaning products, and smoke. So don't smoke around them or try to keep them away from individuals who do smoke. And have them see a doctor if they have allergies, sinus, or respiratory infections regularly. So what exactly is language? This is another aspect of communication, and it's what we really want to focus on today. Its definition is communication using socially shared rules. There are two types: receptive and expressive. Receptive is understanding others. So this is being able to hear from someone else and understand exactly what they meant. Expressive is being able to share one's thoughts, ideas, or feelings. They can choose the words that they want to say, and it actually expresses what they want to say and makes sense to others. What is a language disorder? It is an impairment in the ability to comprehend or use spoken or written language. It may involve difficulty in form, which is like inappropriate combinations of sounds or words that don't go together, or inappropriate sentence formations, so their sentences are all out of order and don't exactly make sense. It could involve difficulty in content, which is difficulty with the meaning of words or sentences. It could also be difficulty in function, so how they use language for social or functional purposes. It can also be a combination of any of these three. So some signs of language disorders include problems understanding what others are saying, problems saying words and sentences, having a small vocabulary, having trouble thinking of words, problems with reading and writing, improper use of words and their meanings, inability to express ideas, and inappropriate grammatical patterns.
Of the 6.1 million children with disabilities who received special education in public schools from 2005 to 2006, more than 1.1 million were served under the category of speech or language impairment. This estimate does not include children who have speech-language problems secondary to other conditions such as deafness, intellectual disability, autism, or cerebral palsy. Some causes of language disorders include hearing loss, neurological disorders, brain injury, intellectual disabilities, parent drug abuse during pregnancy, physical impairments such as a cleft lip or palate, and vocal abuse or misuse such as screaming. Frequently, however, the cause is unknown. How do you know if your grandchild has a language disorder? One way to recognize language disorders is to look at the signs that Ruth had just discussed. You can also use developmental milestones, which I'm about to talk about, or you can have your grandchild screened by a speech-language pathologist. Now we will talk about some developmental milestones. These are things that your child should be doing at certain ages. I'm going to discuss a few for each grade, but you can always find them online in books or magazines, or ask a speech-language pathologist. By the end of kindergarten, your child should be able to do the following. For listening, they should be able to follow 1 to 2 step simple directions in a sequence, listen to and understand age-appropriate stories read aloud, and follow a simple conversation. For speaking, your kindergartner should be able to answer simple yes or no questions, answer open-ended questions such as, what did you have for lunch today? retell a story or event, and participate appropriately in conversations. For reading, they should know how a book works, such as reading from left to right and top to bottom in English. Understand that spoken words are made up of sounds. Identify words that rhyme, like cat and hat. Understand that letters represent speech sounds and match sounds to letters. Recognize some sight words such as the word his, and imitate reading by talking about pictures in a book. For writing, they should be able to print their own first and last name, draw a picture that tells a story, and label and write about the picture, and write upper and lowercase letters, even though they may not be clearly written. By the end of first grade, your grandchild should be able to do the following. For listening, they should be able to respond to instructions and follow 2 to 3 step directions in a sequence. For speaking, they should be able to answer more complex yes or no questions, tell and retell stories and events in a logical order, express ideas with a variety of complete sentences, use most parts of speech or grammar correctly, ask and respond to WH questions, which are who, what, when, where, and why, and also give directions. For reading, your first graders should be able to identify all sounds in short words, blend separate sounds to form words, match spoken words with print, identify letters, words, and sentences, sound out words when reading, have a sight vocabulary of 100 common words, read grade level material fluently, and understand what is read. For writing, they should be able to express their ideas and spell frequently used words correctly. By the end of the second grade, your child should be able to do the following for listening. Follow 3 to 4 step oral directions in a sequence. Understand direction words, such as words about location, space, and time. Correctly answer questions about a grade level story. For speaking, they should be able to use increasingly complex sentence structures, clarify and explain words and ideas, give directions with 3 to 4 steps, use oral language to inform, to persuade, and to entertain, stay on topic, take turns, and use appropriate eye contact during conversation, and finally to open and close conversation appropriately. For reading, your second grader should have fully mastered phonics and sound awareness. They should use meaning clues when reading, such as pictures, titles, headings, and information in the story. They should reread and self-correct when necessary, locate information to answer questions. They should explain key elements of a story, such as the main idea. They should use their own experience to predict and justify what will happen in grade level stories. They should also read, paraphrase, and be able to retell a story in a sequence. And they should be able to read grade level material fluently and independently, and finally identify and use spelling patterns in words when reading. For writing, they should use a variety of sentence types in writing essays, poetry, or short stories, fiction and nonfiction. They should be able to organize writing to include a beginning, a middle, and an end. They should spell frequently used words correctly and progress from inventive spelling, which is spelling by sound, to more accurate spelling.
So, what can you do? Having the child's hearing checked is a critical first step. The child may not have a language impairment at all, but rather a hearing impairment that is interfering with his or her development of language. If a child does not hear the vocabulary used or taught in a classroom at home, they will most likely not be able to comprehend or learn all the skills needed for success. Missing pieces of what is said or confusing to the child, or if the context is confusing, will impede the language learning for the child. How to prevent language disorders. Talk and read with your child. Make every task an opportunity to learn language. Model language skills at all times. Have your child's hearing checked regularly, as we said. Learn about speech and language development, and be sure that your child uses a helmet and seatbelt to prevent accidents that could cause brain injury. So what does this mean? It means you are valuable. Loving and caring for your grandchild's needs mentally, physically, and emotionally in itself is imperative to the development of a child's communication and well-being. Development of language is crucial at this age, and use your time with your grandchildren wisely. What is our goal as caregivers regarding communication? We can help our grandchildren be as successful as possible. We can reduce the risk or effects of the risk factors on a child's development so as to prevent future problems and promote the necessary conditions for healthy development. Promoting positive communication interactions between children, teachers, families, and all other communication partners help to recognize early signs, and these can help prevent further difficulties. Communication is imperative. Because all communication disorders carry the potential to isolate individuals from their social and educational surroundings, it is essential to provide help and support as soon as a problem is identified. While many speech and language patterns can be called baby talk and are part of children's normal development, they can become problems if they are not outgrown as expected. Therefore, it is important to take action if you suspect that your child has a speech or language impairment or any other disability or delay. So, maybe your grandchild is already diagnosed. If so, ways that you can help your grandchild are to learn more about their speech or language impairment. The more you know, the more you can help yourself and your grandchild. Be patient with your grandchild. Like every child, they have a whole lifetime to learn and grow. Be well informed about the speech language therapy your grandchild is receiving. Talk with the SLP. Find out how to enrich the therapy at home and in other environments. Also, find out what not to do. Listen to your child. Don't rush to fill in gaps or make corrections. Conversely, don't force your child to speak either. Be aware of the other ways in which communication takes place between people, such as body language or signs. Talk to other parents and grandparents whose children have a similar speech or language impairment. Parents can share practical advice and emotional support. Grandparents, teachers can also do the same thing. See if there's a parent, grandparent, teacher, SLP nearby, and visit them. USA programs are helpful to do this with an interactive map. Keep in touch with your grandchild's teachers, as we just said. They offer valuable support. Demonstrate any assistive technology that your child uses and provide any information teachers will need. Find out how you can augment your grandchild's school learning at home. These are the resources that we used.
And now I would like to talk about a quick handout that we made just so you can take with you. That was a lot of information. And so we have a quick communication checklist for speech. Check and see if your child or your grandchild is doing any of these things. And then for language, check and see if they are having any problems in understanding what others say, in reading or writing, and saying words and sentences, or if they have a small vocabulary. And remember, you are super grandma or grandpa, and just talk and read and play with your child every day. Correct their incorrect communication in a kind manner. Have your grandchild drink plenty of water to help those voice problems that can occur, and give them time to talk. And enjoy their company because you are their hero.